In mantle cell lymphoma, there was an interesting presentation looking at a window of opportunity from MD Anderson, Michael Wong, looking at ibrutinib rituximab frontline, 2 to 4 cycles, followed by hypercvad. And the idea is to give something frontline and less chemotherapy afterwards, so less potentially toxicity. It's early, there was only 50 plus patients, but the OCR rate after 4 hypercvad were 100%. So this is really interesting. There was no MRD built in that study, but this is something that is very promising. And then there's other combinations that are trying to integrate also novel therapies with the current backbone of mantle cell lymphoma for patients who cannot go on to high-dose therapy. We still need to do a lot of progress because they look at the real world data when in mantle cell lymphoma, where the median overall survival is still basically in a range of 2.5 years. So there's clearly a lot of work to be done in that setting. And in a relapse refractory setting, mantle cell lymphoma, there's some really provocative data. We have the study as well in our institution. It's rituximab, lenalidomide, and ibrutinib combination, where in a relapse refractory patient, the response rate was over 85% and 41% complete remission. So this is something that is interesting, either as a bridge to immunotherapy, cell therapy, or in elderly relapse, where they don't do well with chemotherapy anyway.